DermaClip, a training video. Before using DermaClip, please refer to the full instructions for use available on the DermaClip website. This video is a visual supplement. Applying DermaClip to the skin. Before using the device, ensure the patient is not allergic to adhesive. Properly clean and dry the area before applying, including removal of all dirt and skin oils. Remove excess hair to ensure a good bond with the skin. Never use petroleum-based antibiotic ointments or creams on or near adhesives. First, thoroughly clean and dry the area around the wound. Peel the device off the pad using the pull tabs. Place the devices starting at the end of the wound. You can use as many devices as required to close the full length of the wound. Devices should be placed 1 to 4 millimeters apart. Try not to overlap the adhesive pads. If needed, the devices can be slightly widened. When doing so, only touch the adhesive on its outer edge. Smooth the pads to ensure a good bond. To lock the device, pull the tabs until a click is heard and felt. Use the tooth near the center of the device to enhance your grip. Pull the tabs down and out as pulling up pulls the adhesive off the skin. The click marks a proper closure. Once you've confirmed the clips are locked, the tabs can be cut close to the locking mechanism. Dress the areas using your standard procedures. When applying a dressing, if any tapes are used, make sure that they do not touch the adhesive pads of the device. If permitted by a medical professional, patients can remove the devices by themselves. To remove, gently peel each side of the device towards the center of the wound. Using this method helps reduce strain on the recently healed wound. If needed, using a lotion or oil-based product will facilitate the removal of the adhesive. The locking mechanism. Ensuring the device is locked properly is a critical training element. When the device is not locked, it can slide open. When properly locked, this will not occur. To begin the exercise, remove the pad of devices from the package. Use a marker to create a line on the plastic side of the packaging. This will simulate the wound or incision and allows users to practice without a partner or patient present. Use the plastic tabs to peel the device off the pad. Using this method ensures you do not touch the adhesive. When placing the device, align it so that the pads are on either side of the wound. Then smooth down the pads to ensure a good bond with the skin. Now pull the tabs down and out till a click is heard and felt, signaling locking. To ensure the device has been locked, manually check the closure by pulling the sides of the package. If the device was not locked, the device will slide open when put under tension. You can see it here in slow motion. Since the device was not locked, pull the tabs again until a click is heard to complete the closure. Once closed properly and locked, the device will remain closed even when put under tension. You can see it here in slow motion. Outside of a training environment, you can still manually check the locking of the device. Simply push down on the center of the device to test if it is locked properly. If the device slides open when pressure is applied, it was not locked. You can also perform a visual check to identify if a device has been locked properly. When locked properly, The device is set in a full averted position. For more information, email us or visit us on our website, www.dermaclip.com.